So this is going to be my audience. I'm going to be having 3 people today. Okay, so hi everyone. My name is Michelle Robles, and today we're going to be talking about mental illness. So just a quick fact about mental illness. It is believed that 44 million Americans, or 44 million, or 1 out of every 5th person that you know, is going through some form of mental illness. Now, do you believe this statistic is correct? Based on the people that you know, what they're going through, what you're seeing through them, or do you believe it's more? Do you believe it's less? So during this PowerPoint, we're going to be talking about what mental illness is, how it is diagnosed, and do we know all about it? Are we diagnosing people correctly? Are we diagnosing everybody that needs to be treated? What's going on with that? So let's begin with what is mental illness. Mental illness is any diagnosable mental disorder involving thinking, emotion, and behavior. It could be a combination of all 3. So it affects our social, work, and family activities. It presents itself in forms of anxiety, depression, trauma, psychotic disorders such as schizophrenia, bipolarness, anything of that form. Okay, so while doing this research, I ran into medlineplus.gov, and it gave me a little bit of what causes mental disorders, and pretty much this is the breakdown. So it is caused by genetics, family history, life experiences, chemical imbalances, brain injury, mother exposed to harmful chemicals such as viruses, and or viruses during pregnancy. It's going to affect that fetus, and it's going to be harmful for the baby in the long run. Okay, so also use of alcohol and recreational drugs, medical conditions, social lifestyles, and traumatic events during your childhood. So if you're going through something and it's harsh on a child, you don't think anything of it then if they react good. But maybe 5 years down the line, it might manifest itself in some form of mental illness, and that's due to whatever happened to them as a child. Okay, so secondly, I want to talk about diagnosis of mental illness. So mental illness is diagnosed through medical history, physical exam, psychological evaluation, lab test, and they're also going to look at several signs and symptoms to see if maybe what they're experiencing is due to mental illness, or maybe it was something in the short run or anything like that. So the signs and symptoms that they're looking at is excessive worrying or fear, extreme sadness, major changes in personality, eating habits, or changes in sleeping patterns, dramatic mood swings, so like bipolarness, you're going to be happy 1 second, then something's going to trigger you, you're going to completely go off. Okay, so anger, frustration, irritability, fatigue, lack of energy. A lot of times we see people that have a lot on them, they're starting to go through depression. You see them staying at home for days, not going to work, they don't want to do anything. So that is a form of mental illness, which just, of course, depression is a mental illness. Okay, so confused thinking, trouble concentrating, feeling of guilt or worthlessness, and avoidance of social activities. Just like I said a while ago, they might want to stay at home, not leave for days, weeks, even months. And that takes a toll on them and also their family members. So it affects multiple people. Okay, so I was reading a Scholar article, and it said that back in 1952, they developed a manual to pretty much evaluate a person and see if they were going through some form of mental illness. Back then, a lot of the people in different cultures, different parts around the world, they believed that mental illness or anything like that was a punishment because of sinning. Maybe they were possessed, anything like that. So this was way back over, 50, 60 years ago. They didn't have much information about mental illness, but since then we've discovered many new things. So this manual has changed several times since then. Okay, but it pretty much just broke it down for them with the resources that they did have available to them. Okay, so finally, I want to talk about overlooking the problem. So most of the people, or some of the people that do have mental illness, they're not diagnosed because a lot of the times they feel embarrassed about what the symptoms they're going through, or they don't want to be diagnosed because it's going to affect their job, it's going to affect their family, they're going to look down on them, anything like that. But so these are reasons why people may not be getting the treatment they need, or they might be getting diagnosed, but it's for something else. Okay, so they're not diagnosing it right. So some of those are not, they don't see the problem, they don't recognize that they're actually going through something that would be mental illness. They're denying everything, they're okay, they don't need any help, they're alright. Also, they may not be insured. A lot of the people, they don't have insurance, and this is a lot of money, so they need that. Misdiagnosing, we're going to go back to them not telling psychiatrists, anything medical, that what their symptoms actually really are. They don't want to tell the truth because they're embarrassed. So they just tell a small portion of the problem, so they're not able to see the big picture and diagnose what's going on correctly. Also, even though we do know a lot more about mental illness nowadays, there's still a lot more to learn. So lack of medication, lack of knowledge, lack of facilities, even though it's growing, we still don't have enough for the amount of people that are going through mental illness. And lack of personnel. We don't have people trained, enough people trained to deal with this. Okay, so as an overview, mental illness is a very severe condition. It affects a lot of people, not just yourself, but everybody around you. And even though you think it's not a problem, it's going to affect other people. Or like your child, like I said, it's affecting you. Your child is seeing it. When they grow up, it's going to manifest in a different way. Okay, so it's much bigger than you think. Now, having said all of this, do you believe that 44 million is the number? Is that it? Is that all the people that have mental illness? Do you think it's actually less? Or do you think it's more based on the information that I just provided to you? Okay. So once again, 44 million people. Now, I added this to the PowerPoint, just general information. So these are some of the phone numbers that we have in case you believe that you are experiencing going through something like that, or if you see somebody going through it, which of course call 911 if it's an emergency. But these are not all the numbers that we have available. There's so many more. You just need to have, you just need to look for it, but it's there for you. So yeah, 44 million people. Having said all of that, is it really 44 million? Is it really 1 out of 5? Is your brother, your sister going through some form of mental illness but they're not telling you? Anything like that. It's a big thing. It's a major issue. It can, if not treated promptly, it can trigger suicide. It can do a lot of things. So just keep that in mind. But yeah, hope y'all enjoyed, and it was very educational for you guys.